I'm Dr. Francis Campion. I'm a general internal medicine physician in Boston, and I have the privilege of working with the Get With the Guidelines program through Outcome Sciences. Outcome is the technology vendor for the Get With the Guidelines registry for stroke and for heart failure. And we have had numerous improvements and innovations in the reporting and the use of the system over the last few years. It's very exciting now that hospitals can compare their practices. They can compare themselves to individual groupings, say that they've designated within their own community, or they can benchmark against groups of academic medical centers or community hospitals around the country. And we know that hospitals are using the data on a really daily, weekly basis to involve their quality committees, their emergency room practices, their chiefs of neurology and cardiovascular services to improve stroke care. One of the things we've done just in the last month is, with the new release, we have enabled hospitals to be able to report based on the day of the week. So if a patient came in on a Wednesday, we could look at all the stroke cases that were admitted on a Wednesday, for example, and compare that to the practice for patients coming in on Saturday or Sunday. And this is getting into the real detail level for a local institution on how do we staff our cardiovascular teams, our neurovascular care services. How do we interact with EMS systems, perhaps on the weekend, that may differ from the weekdays. And so we think this is going to actually help promote some of the detail evaluation that hospitals need and communities need to participate in target stroke. So we're very pleased that Get With the Guidelines has brought to national prominence the importance of stroke. We know that continued participation will enable hospitals and communities to continue to improve care and save lives. Although I've been involved with the Get With the Guideline program for a number of years, it was just 2.5 years ago when it came close to home, and my own mother was rushed to the local hospital. And we were fortunate that our community hospital, Newton Wellesley Hospital, just outside of Boston, was a participating hospital in Get With the Guidelines stroke. And it was evident at the time, from the time the ambulance arrived, that the physicians and the nurses in the emergency room were ready to take care of another stroke patient. And she got the best care possible. And we have a lot to thank to the AHA for putting the program together.